Liquid biopsies have the benefit that we can characterize the disease independent from tumor biopsy, not only for sake of invasiveness of tumor biopsy, but also in terms of representativity of the tumor. We'll say when we do punctures, we only have a specific area of the tumor, which is then captured by the pathologist, whereas if we have the DNA profile on the plasma, we have the overall genetic profile. And even more, another benefit is that we have this information over time. Since it's so easy to assess plasma of patients with a simple blood draw, and then with a standardized analysis of ctDNA, we can repeat this and get the molecular information and the change of the molecular pattern over time. And this clearly then has an implication on the respective treatment modality, which has been chosen before or after this. So therefore, this is nothing more, nothing less than just a revolution in GI cancers, because it helps us to understand the biology better, but also the course of treatment. And my personal prediction is that this will partly also substitute for imaging, when we can characterize also whether this treatment is successful, yes or no, at least in the course of metastatic disease.